Okay, so you're here, which means you get it. You want to really figure out this whole healthcare thing.
Yeah, it's a big one, especially for Gen Z. I mean, there's a lot to learn.
Right, and we're diving deep today with you into a bunch of articles specifically aimed at helping Gen Z navigate healthcare.
That's right. Think of this as your ultimate guide to understanding healthcare so you can make the best decisions for your health and well-being.
Exactly. We're going to cover everything you need to know from insurance and preventive care to mental health and all the new technology that's out there.
And we'll break it down in a way that makes sense so you can actually use this information in your everyday life.
So let's get started with the basics. Like, okay, what even is the healthcare system?
Yeah, that's a good place to start. Basically, it's just the way medical services are organized and delivered in a society,
hmm
how it all works.
Right, and the articles we're looking at talk about this key difference between public and private healthcare.
Exactly. Public healthcare systems are usually funded through taxes. Everyone chips in. And the goal is to provide essential medical services to everyone,
Right.
regardless of their income.
Makes sense. So it's kind of like a safety net, making sure everyone has at least basic coverage.
Right, exactly. And then you have private healthcare,
Right.
which relies on individual payments
Right.
or private insurance plans. You pay directly for the services or you pay for insurance that cover those costs.
Okay, so private is more like a choose your own adventure situation where you have more control over your care and potentially access to more services.
Yeah, exactly. And it often means you can get care more quickly, but it does come at a cost.
Mm.
Those premiums and out-of-pocket expenses can add up.
And speaking of costs and insurance, that's another area that can feel super confusing, right? All those terms and different plans.
Definitely. There's a whole language to learn when it comes to health insurance,
Yeah.
but there are a few key terms you really need to grasp.
Okay, like what?
Well, first, you have premiums, which are your regular monthly payments for your insurance coverage. Think of it like your subscription fee for being insured.
Okay, premium equals monthly fee. Got it. What else?
Then you have deductibles, which is the amount of money you have to pay out of pocket for healthcare services before your insurance actually kicks in and starts covering things.
Okay, so it's like a threshold you have to cross before the insurance starts helping out.
Right. And often a plan with a higher deductible will have a lower monthly premium, so you're paying less up front, but you'll have to pay more if you need to use your insurance.
Interesting. So it's a trade-off you have to think about.
Exactly. And then there are copays, which are fixed amounts you pay for specific services, like visiting your doctor or getting a prescription.
Okay, so it's like a set fee per service.
Yeah. And these amounts can vary depending on the plan, so it's important to compare plans and see what works best for you.
So why is it so important for Gen Z to really get their heads around all this insurance stuff right now?
Well, as you're transitioning into adulthood and making more of your own decisions about healthcare, it's crucial to understand these terms so you can choose plans that actually fit your needs and your budget.
Right, because making the wrong choice could really cost you.
Exactly. And no one wants to be hit with surprise medical bills or end up in debt because they didn't fully understand their insurance coverage.
Yeah, that's a good point. And speaking of cost, that brings us to the bigger question of why having health insurance is even necessary in the first place.
Well, the sources we looked at make it very clear healthcare in the U.S. is incredibly expensive, and those costs are only going up.
Yeah, a single unexpected trip to the hospital can end up costing you thousands or even tens of thousands of dollars.
Exactly. And without insurance, you're basically on the hook for all of that, which could lead to some serious financial strain, potentially even bankruptcy.
That's a scary thought. And it's not just about those big emergencies either, right? Going without insurance can impact your health in other ways.
Definitely, being uninsured often limits your access to important preventive care, like routine checkups, vaccinations, screenings, all those things that help catch potential problems early on.
So it's like skipping maintenance on your car, right? Eventually it's going to catch up to you.
Exactly. And those untreated issues can become much bigger and more expensive problems down the line.
So for those who are looking to get insured, what are the main ways to go about it?
Well, one of the main options is the health insurance marketplace, which was created under the Affordable Care Act. You can go online and compare different plans from various insurance companies.
So it's kind of like shopping for insurance.
Exactly. And these plans are organized by different metal tiers: bronze, silver, gold, and platinum, which basically reflect the balance between your monthly premium and your out-of-pocket costs.
So the higher the metal, the more expensive the monthly premium, but the less you pay when you actually need care.
Exactly. And then the other common way to get insurance is through your employer. Many companies offer health insurance as part of their benefits package.
Right, so if you're working, you might have that option.
Exactly. And no matter how you get insurance, the key is to really review the details of each plan before you sign up.
Understand what's covered, what your deductibles and copays are, all that good stuff.
Yes, because ultimately you want to choose a plan that aligns with your individual needs and your budget.
Okay, now let's talk about something you have a lot more control over: preventative care. What does that actually mean for someone in Gen Z?
Preventive care is basically about taking proactive steps to stay healthy and reduce your risk of getting sick in the first place.
So it's like focusing on wellness rather than just waiting until you're already feeling bad.
Exactly. And it's really important for Gen Z because building those healthy habits now can have a huge impact on your health in the long run.
So what kinds of things are we talking about here?
Well, one of the most important things is establishing a relationship with a primary care physician or PCP.
Right.
They're kind of like your main doctor, the person you go to for regular checkups and general health concerns.
Okay, and why is having a PCP so important?
Having that consistent relationship with a doctor allows them to get to know you and your health history, which means they can offer more personalized advice and care.
Right, it's like having someone who's in your corner when it comes to your health.
Exactly. And they can also help coordinate your care if you need to see specialists or manage any chronic conditions you might have.
So it's about having that central point person for your healthcare.
Exactly. And then in addition to regular checkups, there are a bunch of different screenings you should be aware of.
Okay, like what?
Well, there are important vaccinations like the HPV vaccine, which protects against certain cancers, and the annual flu shot.
Right, those are essential.
Yes. And depending on your age and risk factors, your doctor might recommend blood pressure and cholesterol checks, as well as screenings for things like STIs.
So it's really about being proactive and catching things early on.
Exactly. And the sources also highlight that conversations about your mental health are a crucial part of preventive care, too.
Right, because mental health is just as important as physical health?
Absolutely. And it's important to remember that these seemingly small measures taken now can really pay off in the long run by preventing more serious health problems down the road.
Okay, so we talked about regular checkups and screenings. Any other tips for making the most of your doctor visits?
Yeah, definitely. The sources suggest coming prepared with a list of questions you have for your doctor, no matter how small they might seem.
So don't be shy about asking anything that's on your mind.
Right. And it's also a good idea to bring any relevant medical history you have and jot down any specific concerns or symptoms you've been experiencing.
Being proactive like that can really help you get the most out of your appointment.
Exactly. And it shows your doctor that you're actively engaged in your healthcare, which is always a good thing.
Okay, now let's talk about something that's particularly relevant for Gen Z mental health. The sources we've looked at really emphasize this is a major concern right now. Why is that?
Well, there are a lot of factors at play. I think the constant pressure to present a perfect image on social media, the stress of academics and starting your career, the uncertainty of the world in general, it all adds up.
Yeah, it feels like there's a lot of pressure on Gen Z from all sides.
Definitely. And it's taking a toll on mental health. The sources point to anxiety disorders, depression, and ADHD as being particularly prevalent among young people.
And I think there's still a lot of stigma surrounding mental health that prevents people from seeking help.
Yeah, absolutely. And that's something we need to work on. It's okay not to be okay. And seeking help is a sign of strength, not weakness.
Absolutely.
Now, speaking of help, what kind of resources are out there for Gen Z specifically?
Well, the good news is that access to mental health support is expanding. One of the biggest changes has been the rise of telehealth, which is basically virtual therapy.
So you can connect with a therapist online from anywhere.
Exactly, and that's made it much easier and more convenient for people to get the help they need, especially if they're not comfortable with traditional in-person therapy. Right, that accessibility is so important. And what about things you can do on your own to support your mental health day to day?
Well, self-care is crucial. Things like practicing mindfulness, meditating, going for walks, getting enough sleep. These things can make a huge difference.
So it's about building those healthy habits into your routine.
Exactly. And also about building a strong support network surrounding yourself with people you trust and who care about you.
Okay, so we've covered a lot of ground here, from the basics of the healthcare system to the importance of preventative care and mental health.
Yeah. And now let's shift gears a bit and talk about how your everyday choices and habits impact your health in the long term.
Okay, so we're talking about lifestyle choices.
Exactly. And one of the biggest areas to focus on is nutrition. What you eat has a huge impact on both your physical and mental health.
Right, we all know that, but it's easy to fall into bad habits, especially with all the processed foods and sugary drinks out there.
Yeah, and those things can really catch up to you over time, leading to weight gain, chronic diseases, even mental health problems.
So what's the key to developing healthy eating habits?
The sources emphasize focusing on whole, unprocessed foods, fruits, Vegetables, lean proteins, whole grains, that kind of thing.
So basically eating real food as much as possible.
Exactly. And being mindful of portion sizes and limiting processed foods, sugary drinks, and unhealthy fats.
Makes sense. What about exercise? What role does that play in overall health?
Regular physical activity is incredibly important. It helps reduce your risk of chronic diseases like heart disease and diabetes, and it's great for stress relief, improving your mood and boosting your energy.
So how much exercise do we need?
The sources recommend aiming for at least 150 minutes of moderate intensity exercise per week, which sounds like a lot, but it could be as simple as going for a brisk walk every day.
Right. You don't have to be a marathon runner to reap the benefits of exercise.
Exactly. And it's important to find activities you enjoy so you're more likely to stick with it.
Now, the sources also touch upon some riskier lifestyle choices that are particularly relevant for young adults, like substance use.
Right? Vaping and alcohol consumption are major concerns, and it's crucial to be aware of both the short-term and long-term risks associated with these habits.
So education and awareness are key.
Exactly. And then there's sexual health, which is another important aspect of overall well-being.
Right. Being aware of safe sexual practices and having access to contraception are crucial for Gen Z.
Definitely. And it's about making informed decisions and protecting your health both now and in the future.
Okay, let's move on to another big topic, the role of technology in healthcare.
Yeah, technology is revolutionizing healthcare in so many ways, and it's particularly relevant for Gen Z who are digital natives.
Right, so how is technology changing the game?
Well, one of the biggest impacts has been the rise of telemedicine, which allows you to have virtual consultations with healthcare providers from anywhere.
So it's like a virtual doctor's visit?
Exactly. You can have video calls or message with your doctor and get advice, diagnoses, prescriptions, all without leaving your home.
That's so convenient, especially for people with busy schedules or who live in rural areas.
Exactly. And then there are all sorts of health apps out there now that can help you track your nutrition, exercise, sleep, medication, and more.
So you can basically have a personal health assistant in your pocket.
Yeah, and these apps can really empower you to take control of your health and make positive changes.
And then we have wearable devices like fitness trackers and smartwatches that are giving us more data about our health than ever before.
Right. You can track your activity levels, heart rate, sleep patterns, even stress levels, all in real time.
So it's like having a constant health check.
Yeah, and that data can be really motivating, helping you see the impact of your lifestyle choices and make adjustments as needed.
But are there any downsides to all this technology in healthcare?
Well, the sources caution against relying solely on self-assessment tools and online information.
Right. It's important to remember that technology is a tool. It shouldn't replace the expertise of healthcare professionals.
Exactly. And there are also concerns about data privacy and security with all these apps and devices collecting so much personal information.
So it's about using technology wisely and being aware of the potential risks.
Definitely. And it's also important to remember that technology is constantly evolving. So what's available today might be completely different in a few years.
Okay, let's talk about another area that can be confusing, prescription drugs.
Yeah, there's a lot to know about prescription drugs. But one of the most important things is to understand the process of getting a prescription.
Okay, so how does that work?
Usually you start by visiting a healthcare provider, a doctor, nurse practitioner, or physician assistant. They'll evaluate your condition, taking into account your medical history, any other medications you're taking, and any allergies you have.
So it's a pretty thorough assessment.
Right, and if they decide that medication is necessary, they'll write you a prescription, which you can then take to a pharmacy to be filled.
And when you get that prescription, you'll often hear about brand name versus generic drugs. What's the difference?
Well, brand name drugs are the original drugs developed and marketed by pharmaceutical companies. They're usually more expensive because the companies have patents on them.
So they have a monopoly on that specific drug for a certain period of time.
Right. And then once the patent expires, other companies can start making generic versions of the drug.
And generic drugs are basically the same thing as the brand name drug, but cheaper.
Exactly. They have the same active ingredients, dosage, strength, and effectiveness, but they cost significantly less.
So it's always a good idea to ask your doctor or pharmacist if there's a generic option available.
Yes, you can save a lot of money without sacrificing quality or effectiveness.
Now, what about once you have your prescription in hand, what are some key things to keep in mind?
The most important thing is to take your medication exactly as prescribed by your healthcare provider, the right dosage, at the right times for the full duration.
So no skipping doses or stopping early even if you start feeling better.
Exactly. And it's also crucial to be aware of potential side effects and any interactions your medication might have with other drugs or supplements you're taking.
Right, because those interactions can sometimes be dangerous.
Exactly. So if you're ever unsure about anything, always talk to your doctor or pharmacist. They're your best resources for information about your medications.
Okay, now let's talk about being your own health advocate. Why is this so important and how can you do it effectively?
Well, the healthcare system can be complex and overwhelming, and it's easy to feel like you're just going along with what the doctors tell you.
Right, but you have a right to be an active participant in your healthcare.
Exactly. Being your own health advocate means speaking up, asking questions, and making sure your needs and preferences are respected.
So it's about being informed and empowered to make decisions about your own health.
Yes. And it starts with understanding your basic healthcare rights. You have the right to information about your diagnosis, treatment options, and prognosis. You have the right to consent to or refuse any treatment, and you have the right to access your medical records.
So it's about knowing your rights and being assertive.
Exactly. Yeah. And there are also practical things you can do to be a better advocate, like preparing questions for your doctor's appointments, bringing a friend or family member for support, and taking notes during your visits.
Those are all good tips. And finally, let's talk about finding reliable health information online.
Yeah, with so much information out there, it can be tough to know what to trust.
Right, there's a lot of misinformation and misleading claims out there.
Exactly. So it's important to stick to credible sources like the Centers for Disease Control and Prevention, or CDC, the World Health Organization, or WHO, and government websites like Medline Plus.
Those are all good places to start.
Yes. And there are also reputable organizations like the National Institutes of Health, or NIH, and the Mayo Clinic that provide reliable information.
And don't forget about your local health department. They often have valuable resources for your specific community.
Right. And it's always a good idea to be skeptical of information you find online, especially if it seems too good to be true or if it's promoting a specific product or treatment.
So double check everything with your doctor or a trusted healthcare professional.
Exactly. They can help you sort through the information and make sure you're getting accurate and reliable advice.
So to wrap things up, we've covered a lot of ground in this deep dive, from understanding the healthcare system and health insurance to preventive care, mental health lifestyle choices, technology, and finding trustworthy information.
Yeah, and the key takeaway is that being proactive, informed, and engaged in your own healthcare is essential for Gen Z.
It's about taking ownership of your health and well-being.
Exactly, and it's about equipping yourself with the knowledge and tools you need to make the best decisions for your health both now and in the future.
Absolutely. And here's a final thought to consider as we become more reliant on technology for healthcare. How might the increasing availability of personalized health data from wearable devices and other sources impact the way we interact with healthcare providers in the future?
Yeah, that's a really interesting question to think about. Will we be able to use this data to advocate for more personalized care? Will it change the doctor-patient relationship in fundamental ways?
And what about the privacy and security of all that data? Who has access to it and how is it being used?
Those are all important questions to consider as we move into this new era of healthcare.
Absolutely. Thanks for joining us for this deep dive into healthcare for Gen Z.
Yeah, we hope you found it helpful and informative.
And remember, your health is your greatest asset, so take care of it.
And don't be afraid to ask for help when you need it.
We'll see you next time on The Deep Dive.